Hey guys, welcome back to my channel. This is Dr. Rajeshwar from YR Pharma Tube. Previously, we discussed on general anesthetics. If you did not watch them, hit the I button on top right of this video to watch them. To watch the other topics of medicinal chemistry, click on the links given in the description below this video. In today's lesson, we shall begin with anesthesia and anesthetics, which is a part of an introduction to local anesthetics. Anesthesia is a loss of feeling or sensation. In other words, it is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. It may include some or all of analgesia, that is relief from pain, paralysis, that is muscle relaxation, amnesia, which is the loss of memory, and unconsciousness. A person under the effects of anesthetic drugs is referred to as being anesthetized. Anesthesia enables the painless performance of medical procedures that would otherwise cause severe or intolerable pain to a person who is not unanesthetized or would otherwise be technically unfeasible. Anesthesia may be induced by various drugs known as anesthetic drugs or simply anesthetics that can bring about partial or complete loss of sensation. There are three types of anesthesia. Number 1, local anesthesia. Number 2, regional anesthesia. And number 3, general anesthesia. Number 1, local anesthesia. As the term implies, it is the provision of a sensation-free state in a specific area or region. With a local anesthetic, the patient is often awake enough to follow directions but does not feel pain in the area that has been anesthetized. However, some procedures performed under local anesthesia may require the patient to be sedated. Although not fully awake, sedated patients may still hear what is going on around them. Number 2, regional anesthesia. As implied by the name, it offers a numbing sensation to a larger area or region of the body, such as the lower limbs or the pelvic area. And number 3, general anesthesia. It is the provision of a sensation or pain-free state for the entire body, which means general anesthesia suppresses central nervous system activity and results in unconsciousness and total lack of sensation using either injected or inhaled drugs. When a general anesthetic is given, the patient loses consciousness, has no control, and feels no pain. Reflexes such as the swallowing and gag reflexes are lost during deep general anesthesia. Anesthetic drugs, which are going to be discussed in the coming lessons, are used to eliminate the sensation of pain, which completes the spectrum of pain management. In other words, anesthetic drugs are given to prevent pain and promote relaxation during surgery, childbirth, some diagnostic tests, and some treatments. They interrupt the conduction of painful nerve impulses from a site of injury to the brain. The two basic types of anesthesia are general anesthesia and regional anesthesia. The figure shown here illustrates the sites and mechanisms of action of drugs used for anesthesia. Both physicians and nurses administer anesthesia. These providers are also responsible for monitoring the vital functions in the body as the surgical procedure is carried out. An anesthesiologist is a physician with special training in administering anesthesia. A nurse anesthetist is a registered nurse with special training who is qualified to administer anesthetics. This is the list of references followed for the lesson. That's all in this video, an introduction to anesthesia and anesthetics. In the next lesson, we will discuss on the historical development of local anesthetics. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.